We also apologise for the lengthy delays that some people have experienced. In fact, we see these increasing lines right around the country at the moment. So we're not immune to it here in South Australia. We've very significantly flexed up our capacity across the state from about 2,000 tests per day going back 3 or 4 weeks to 20,000 tests at the moment. So I really want to thank SA pathology staff and also our private pathology labs in South Australia for being able to so rapidly flex up their capacity. But we now have received advice from SA Pathology and SA Health that we can reduce the testing requirements for those people coming from interstate who do not have symptoms. So we're still requiring people coming from interstate, in fact all South Australians who have symptoms, to go off and get the PCR test. But we are reducing the requirements for those people coming from New South Wales, Victoria and the ACT who were required until today to have a test on arrival. We're no longer requiring that if no symptoms are present. It is still a requirement to have a test within 72 hours of departure and to have that negative return to allow entry into South Australia, but effective immediately, those people coming from interstate that were previously required to have a test on arrival are not required if they have no symptoms. Now we are saying to all South Australians that this is an important move because we want any person in this state who does have symptoms to go and get themselves tested. We're strongly advising people who develop symptoms to isolate, go on to the SA Health website and book in to one of our many testing sites across the state. In fact, there are more than, I think there are about 12 now sites where you can book in online and get that opportunity to go in for that rapid test. We know that the lines have been very frustrating for people, and that's why we're saying you do not need to be in that line. You can make a booking online via the SA Health website for 12 sites, metropolitan and country, from Mount Gambier right into the centre of our city at Victoria Square. So we're strongly encouraging people to do that. Now tomorrow we will be having a National Cabinet meeting. The next National Cabinet meeting was actually scheduled for February next year. It's been brought forward because we are concerned about the increasing number of infections around the country. One of the things that we will be looking at there is the requirement for boosters. We were strongly supportive of reducing the gap between the second dose and the booster from 6 months down to 5 months. It's our belief here in South Australia that we should consider reducing that down again. That will be our position that we go to the National Cabinet with tomorrow. We're keen to hear what ATAGI, the Australian Technical Advisory Group on Immunisation, has to say about that. We would like to have a consensus decision, but we are very keen to provide the opportunity for people to get those boosters sooner because we know that will increase their protection. We also know that there are many South Australians who are already eligible for that booster shot, and the strong advice from myself, from SA Health, from Nicholas Berry is to go and get that booster as soon as you become eligible. It will increase your immunity or resistance to this disease, and that's a high priority for us. We've also been receiving lots of requests for further information regarding the rapid antigen test. In fact, I had quite a lot of questions about this yesterday at the press conference. We are considering our position with regards to the rapid antigen test. I've got to emphasise though that this is not a test suitable for people who have symptoms. The PCR test is the one that people need to have if they have symptoms. The rapid antigen test is used already in some states who are further down the track than we are as a surveillance for those people who are fully vaccinated and do not have symptoms. So we are rapidly coming to the point in South Australia where we will be in a position to advise that these will be available in our state. Not quite yet, but we are really doing everything we can now to free up capacity within our testing sites across South Australia and make them available for those people who have symptoms. So I'll now open up to any questions and then we'll move to Professor Nicholas Berrier, who will give us the daily count.
I mean, wasn't this entirely foreseeable that when you open up the borders and you have so many thousands of people moving interstate, into South Australia, that you would have seen a massive surge like you have in recent days at our testing clinics did you do enough to prepare for that?
Absolutely. So what we did was we massively flexed up our capacity across SA pathology sites, and I do want to acknowledge and thank all of those people in SA pathology. I think Dr. Tom Dodd said yesterday around a 300 person increase in SA pathology over the last month, getting ready for the inevitable surge. So we've gone from about 2,000 tests a day to about 20,000 tests. This was very important to slow the spread in the early days, but now of course we've received that advice from Dr. Dodd and also from Professor Nicholas Berry. We've considered that and we'll reduce that testing arrangement. I was speaking to Dr. Dodd yesterday. He said with the 4,700 tests on Sunday, I think it was, for those people coming in from Victoria, there was less than a 1 in 1,000 chance that was going to be a positive case. And so we'd much rather keep that capacity now for South Australians with symptoms. But I've also got to strongly message to all South Australians that we do have an ability to book in 12 sites right across the state, and this is definitely the way to go. We're not encouraging people to go and sit in their cars for hours and hours. They can go onto the SA Health site, they can book in, they can arrive within that hour slot, and they can go and have that test.
We've been told the whole time that people can be asymptomatic and have COVID and be passing it on. Isn't this a backflip on the messaging by saying that we're not worried about those asymptomatic people now? We're not going to make these interstate arrivals get tested?
So we're comforted by the fact that virtually, well, every single person coming from interstate now has to have that PCR test in their own state within 72 hours of departure. So there is already a 100% screen for those people coming from interstate. Our focus now is on making sure that South Australians have access to a rapid PCR test. Now, I've been told by Dr. Dodd that, of course, there's two parts to the SA pathology issue. One is the testing itself, the other one is getting the results. The results are still coming back in very, very short time compared to just about anywhere else in the country, so that's a big tick there. What we do want to avoid though is having these lengthy lineups which would potentially discourage people from doing the right thing. So that's one of the reasons why we've made this decision, but also because we have a 100% screen on all of those people coming from interstate.
Doesn't this change the modelling?
Following on from Rory, is your government failing to learn the lessons of what we've seen previously? I've sat here, we've all sat here, this is probably the third or fourth time you've stood at that podium and apologised for the significant wait times that everyone could envisage would happen. Are you actually not, are people not learning the lessons of history from our previous outbreaks?
I've just sort of outlined, we have actually gone from 2,000 tests a day to 20,000 tests a day. And we have also put on a very significant increase in the workforce in SA pathology. So I think what we'll see happen later today, and we're basically going almost car to car right across the testing sites in South Australia, saying if you are from interstate and you have no symptoms, you can leave that line. We're still asking those people, of course, to monitor their symptoms. We do not want a situation where somebody leaves the line if they do have symptoms. That is obviously problematic, but I think we'll see those lines massively reduced today.
The Premier also did close down a number of clinics in the lead up to our borders opening, so were you properly prepared?
Well, as I said, we've gone up to 20,000 capacity, which is a massive capacity. Even at the height of the clusters in South Australia, we were only just touching that point. But look, there are people that I think are feeling genuinely anxious about Christmas, so we are seeing a higher number of people going there, and that's why we say we've learned the lessons from the previous round, where there were very long, lengthy delays, some people more than 24 hours, and we put in place a book-in app. Now, to date in South Australia, there's still a large number of people who are, in fact the majority, who are not using in this booking-in app. And my strong message to the people of South Australia is there is no need to go and line up for hours and hours. You can make a booking, get online, make that booking, and then turn up with a very much shortened time frame. But also we're removing the bulk of those people that have been using those testing facilities over the last week or so.
Does changing this testing requirement alter the modelling and the predictions that the modelling have come out with?
Well, the modelling evolves over time, Alan. It's a very good question, and this is one of the reasons why I'm very keen to get to the National Cabinet tomorrow. If you go back to the original Doherty Institute modelling that was presented to the National Cabinet, which resulted in us developing the framework for opening our state borders, it was when Delta was the dominant variant here in Australia. Now, since then, we've had Omicron come in. We're basically handling this in real time right across the nation, right across the world. We are seeing the numbers right across the country increasing over and above what that model was showing when we looked at it back in September and October. But we also know that we are seeing lower level symptom severity with the Omicron cases, and we're also seeing that there is probably a very likely outcome that there's lower level hospitalisation. So all of those things need to be taken into account. When we look at the numbers today in New South Wales, and one advantage I suppose that we have in South Australia is we're several weeks behind those other states which are experiencing higher numbers because there was much greater seeding and they've had many more cases of Omicron than we've had. We are seeing a massive surge in terms of their daily infections. I think New South Wales today is up to around 3,000, but we're still seeing very low numbers presenting in hospital. Now, in the lead up to opening our borders in South Australia, the COVID Ready Committee put the resources in place, and one of those things was to flex up the available bed capacity across our health system. So we've created the equivalent of around 400 beds across the system in South Australia. To date, I think we have 5 or 6, or certainly 5 yesterday, people that had actually had to be admitted to hospital. So look, the reality is we are dealing with a new variant. We're putting as many speed bumps in the way of that new variant as possible in South Australia, but we're inevitably going to follow a similar trajectory at a lower level, but a similar trajectory to what we've seen in other states, which is a higher level of infection, but hopefully a much lower level of hospital presentation.
Is there any ADF personnel still on the cards, or is this supposed to reduce the capacity that won't be needed?
No, we're not calling upon the ADF at this
Premier,
point.
we're hearing that bookings are not being honoured anywhere but Ridgehaven, and people are turning up for their testing booking to be told to get to the back of the line regardless.
No, well, I haven't had those reports. In fact, I've had many people who have told me that the booking system works extraordinarily well, admittedly not with the site that you're talking about, but my understanding is it's working well, but we can check that.
Premier, all the testing, is it all the testing requirements, so including the day 6 test, and for people that are already here, they don't have to continue with the regime of testing? Is that all testing is gone?
No, we're constantly looking at the testing arrangements, and if there are others that we need to change, then we will do that. But at this stage, the only thing that we're changing is the removal of the day 1 compulsory test for all those people coming in from New South Wales, Victoria and the ACT. But we are evolving the situation that we have in South Australia, and we will continue to look at the testing requirements, the most appropriate testing requirements going forward, and when we've got further advice, and we'll certainly provide that, Andrea.
In regard to the booster shots and,
Yes.
and potentially bringing them forward, at what point do you foresee that it will take 3 shots for you to be considered fully vaccinated?
Yeah, it's a really good question. It's one that's already been considered at the National Cabinet. The National Cabinet hasn't made a decision yet because we haven't received that ATAGI advice, but it's quite possible that a 3rd dose will be required for people to be fully vaccinated. What we know is that the current mRNA vaccines are very successful at slowing the spread of the Delta variant. We know that there's probably a reduced efficacy with regards to the Omicron variant. We know that you boost that immunity or that resistance up again if you have that 3rd dose. But it's still early days. Let's not forget that this was only declared a variant of concern by the World Health Organization 3 weeks ago. So all of these technical bodies are trying to work as quickly as possible, but also making sure that they're providing the right advice. I'm very pleased that we'll be having a National Cabinet meeting tomorrow where we'll get further updates from the Doherty Institute, also from ATAGI, TGA, all of those feeding through the AHPPC and the Health Ministers meeting. There's a Health Ministers meeting later today. So I think everybody in this space is working around the clock to provide the very best response to Omicron. The good news is that to date, despite the number of new infections escalating in South Australia, we're still seeing a very small number of people requiring hospitalisation. Now, that's the situation in South Australia. Where we're looking very carefully is what is the situation in New South Wales and Victoria, where they already had seeding of the disease. What has been the response to the escalating numbers? and correlating that increase with the hospitalisation rate. At the moment, it's still not particularly worrying, but we are looking at it very closely on a daily basis.
Premier, could I just ask you, was it SA Health that came to you and said, or the Commissioner, and said, we don't no longer need interstate arrivals, or did you order a review and ask them to reconsider their position, and are they then therefore on board with these new changes?
So there's no ordering. I suppose what we're doing is getting information in on a daily basis. In fact, I spoke to the media about it yesterday after the press conference, that there becomes a law of diminishing returns with regards to certain cohorts, and you've got to move to another cohort which is a higher level. So when you are having a 100% screen on everybody coming in from New South Wales, Victoria and the ACT, you know, the next test, day one of arrival, is less useful than people with symptoms in South Australia, and so it's basically a mathematical model, and so I wouldn't say that anybody ordered it. Everybody arrived at the same position pretty much at exactly the same time.
Just to clarify from Huffy's question
Yes.
earlier, so is the day 6 test still required?
At this stage, but as I said, we are obviously looking at all of these testing requirements, and if we've got any further update to provide, then we'll provide that.
Premier, can we just go back to the booking system?
Yes.
I mean, the feedback that we have been getting at ABC News is that it isn't working, that people are going to there a lot of times and they're being told to either wait for hours until they actually get seen or not. Do you need to streamline that process better? What more can you do to improve that if you're trying to direct people towards that particular method of testing?
Yeah, we're certainly directing people towards booking in online. Now, some people have experienced some confusion at certain clinics or PCR clinics or testing clinics, then we apologise for that. But this is the best way to go. We just don't think it's appropriate for people to have to sit in their cars for hours and hours and hours. With the testing, they get an hour booking slot for them to arrive. There still may be a wait, but it's not going to be an extended wait like we see if people arrive who haven't booked in.
Can I please ask about, Professor Spurrier spoke a few weeks ago
Yes.
how that if you've got COVID, tell everyone you know, and now we're seeing a Facebook page being used by a lot of people in the community updating exposure sites. One person has written in there that she was at a nightclub on Wednesday night. 13 people there have caught COVID from there. She said she's had a contact tracing interview, but none of those sites that she's identified to those contact tracers have since been put up as exposure sites. Why is that not sort of happening at the moment?
Well, I can let Professor Spurrier go through the details later, although I doubt that she will have the specifics of an individual case. But as I said yesterday, we are moving into a different phase. So if you go back 2 or 3 months, a single case was something very, very concerning because it could lead to an outbreak that would put the state into lockdown. We saw lockdowns in Melbourne, in Sydney, in ACT. In fact, at one stage, more than half the population of the country was in a lockdown situation. We avoided that because we had extraordinarily tight, extreme TTIQ. Now, the model that was provided by Doherty was to move from extreme to optimal, and then from optimal to partial, and it's got to be a prioritised response, and that's precisely what we're doing in the South Australian response at the moment. So the Communicable Diseases Control Branch is in the process of moving from optimal to partial, and they prioritise their cases. Now, we are getting a high number of cases on a daily basis. It's impossible to respond the same way we would have 2 or 3 months ago. It's also inappropriate to respond that way. So we've got, I think, very well tested public health protocols which are being observed in South Australia, but we are in transition, just as many other parts of the world have had to go through this transition.
Just on that point,
following
just
from
on that point.
Can I just, sorry, Rory, can I just, is SA Health becoming overwhelmed with this? And we don't even have the same similar numbers that we've got, that we're seeing interstate or even overseas, but contact tracing's apparently not keeping up, testing is not being kept up, all the other things that they're doing don't seem to be keeping up with the demand. Have they got enough resources, and are they being overwhelmed?
They do have enough resources, but I think the point is that many people have still got their head in the mindset of what was required 2 or 3 months ago in terms of very tight TTIQ. This was obviously crucial at that time. It is not the same now, and I can't emphasise that enough. We're moving into a different phase. it didn't matter when we made this transition, it was always going to be messy, with some people thinking, well, why aren't we doing what we were doing months ago? Well, because we are in a different phase now, and I think I've been trying to message for quite some time now that there was an inevitability that there would be additional cases. We are going to see those cases continue to increase. The crucial thing that we need to be focused on here in South Australia is making sure that our health system stands up. We've put an additional equivalent of 400 beds into our health system. We still have very few people that have been put into hospital. As of yesterday, we didn't have a single person who had gone through to ICU or a ventilator. And importantly, we're monitoring the situation in New South Wales, where we're still seeing a very low hospitalisation rate. Even though they have 2,000 or 3,000 cases per day, we're still seeing a very small number of people ending up in hospital, and an even smaller number of people going on to ventilators. So it's all about trying to get the balance right in South Australia. That's why we've listened to science and evidence. We were thrown a curveball with the arrival of Omicron. That's why I'm very pleased that we will be having a meeting tomorrow of the National Cabinet where we can get a further update. But even here in South Australia, virtually on a daily basis, we're getting new information through.
How many cases did we end up having at the cricket?
Look, I'm not 100% sure of that.
And the other question is, with the rapid antigen testing, is the reason that we aren't quite on board yet just because we don't have the supply?
No, we've got supplies both within SA Health. Look, let's go back. The rapid antigen test is being used in South Australia in a range of health settings and also in industry-specific sectors where surveillance of people who are non-symptomatic and fully vaccinated is our highest requirement. It's not suitable just as a broad replacement for the PCR. I've got to emphasise the PCR test is what we want for anybody that has symptoms, but we are rapidly getting to a situation where we would like to be able to provide that broader surveillance opportunity, and that should come through fairly soon. So we've got large stockpiles within SA Health. We understand that the private sector also has large stockpiles, so they're ready to go, and we should be in a position to update you very soon on its suitable rollout in South Australia. But it does require some education, because if people think that this is a replacement for the PCR tests, then they're wrong, and this wouldn't be good from a public health perspective.
Can I ask you about moving to partial TTIQ?
Yes.
And some of those high risk settings that you're targeting under that? I would assume, and correct me if wrong here, would be aged care. How worried are you about outbreaks in aged care homes across South Australia at this point in time?
So we have very tight controls on aged care, residential aged care facilities in South Australia. And I've got to say, I'm very grateful to all of those people that are working in that setting. We put a mandatory vaccination regime in place for aged care facilities. We know that the managers of those facilities have kept very tight control on those people coming in and leaving those sites, because they are a more vulnerable cohort. We are keen to make sure that we can get boosters to all of those aged care workers as quickly as possible, but also to the residents. So this is a shared responsibility between the Commonwealth and of course us here in this state. We have been able to keep our vaccination clinic operations in South Australia open in South Australia. We're now revisiting some of the closures that we were planning, and the reason for that is we think that there will be an increase in the number of people looking to have boosters in South Australia, and if there is a changed position tomorrow at National Cabinet, we will need to be able to flex up that capacity. I think some of you probably heard from me a week or so ago that we were going to go into a bit of a lull before we came through to the 10th of January for children aged 5 to 11, and then for the bulk of those people that were coming up to their booster, which would start in February now instead of March. Now, if we bring that forward, of course, that brings a lot more people eligible straight away, and so we'll look at just flexing up those vaccination clinic opening times going
Can I
forward.
also ask you about, we're seeing long waits here in South Australia
Yes.
for testing. We're also seeing this mirrored, particularly on the eastern seaboard in Melbourne and Sydney, for people who are coming in or trying to get that 72-hour test to come to South Australia. We know that in some circumstances, those test results aren't coming necessarily in that 72-hour time frame. should they still be travelling if they haven't actually received that negative result, or is that something you're looking at over the coming days?
Look, it hasn't been raised with me, but I'm happy to take it on board. Look, the reality is we've made it a requirement to have a test within 72 hours of departure and to have that negative result before people come into South Australia. What we're removing today is the requirement to have a further test on arrival. But I'm happy to look at that issue and come back to you, Rory.
Premier, can I just ask you, we're getting reports that travellers in lines at the airport are being told by staff that they've not been advised of the directive and advising people to actually stay in the line. Is this more evidence of rules being rushed in to try and alleviate public criticism? And is this again showing the chaos of all of this?
Look, Andrew, we've just made a decision today. We wanted to alert the people of South Australia as quickly as possible. If there's a hiatus of a half an hour or an hour down at the airport, we apologise for it. But people who are in those lines now, if they do not have symptoms, should feel quite willing to leave and go about their business. We are asking every single person that comes from Interstate, though, to monitor their symptoms. If they develop any symptoms, we're asking them to isolate and book in and go and have one of the tests.
Can I ask about Professor Celia?
Thanks and good morning. I do just have a few comments to make, if that's all right, Harvey, first. We do have some new cases today, but I just wanted to perhaps put a little bit more context around why we've changed this requirement today. And we've been monitoring this situation very closely. And if you imagine that when we opened the borders, we wanted to do that in a slower way. So that's why we had requirements for people to be tested when they came into our state. But we did appreciate that once we started to have more cases in our own state, then really our focus is on those people that have symptoms here in South Australia. So last week when I had a look at this on Thursday, it was about 30% of our cases were coming from our interstate travellers and about 10% from international arrivals. And then the rest of those were either close contacts of cases or there were some that were not linked. But now that we've got increasing cases, I can just give you the breakdown for today, and I'll just let you know that we have got 154 cases that we will be reporting today. But looking at the percentages of those cases, locally acquired is 134, so that's people in South Australia. That's now 87% of all of those cases, whereas interstate arrivals is only 2%, so that's obviously dropped from 30% down to 2%. Overseas is less than 1%, and close contacts of cases is 10%. So we are now seeing, as one would expect, now that we've had the borders open, we're seeing more cases within our own community. And so it absolutely makes sense today to make that decision to not require interstate travellers to be tested in more of that surveillance capacity. But as the Premier really put very clearly, if anybody from interstate has symptoms, they do need to get tested. Now, I don't like to correct the Premier, but we had a lot of things we discussed this morning, and in fact we are removing the requirement for both the day 1 and the day 6 for the interstate travellers, so that is in response to your question, Andrew. So, and that makes sense if you can see my logic in terms of the cases we're getting and who's actually testing positive at the moment. So this will mean that we have absolutely a focus on symptomatic people in our state, as we have done many times in the past. And I know it seems that we do change things quite quickly, but a pandemic evolves very quickly. And this is part of our planning, is that we keep looking at the data and then we make decisions on the basis of that. So we really need to have people that have symptoms in our state able to access the testing as soon as they possibly can. And also the other important group from my perspective is the close contacts of cases, and we're just looking at those requirements at the moment. We definitely need all close contacts to continue getting tested, but again, as things evolve over coming weeks, we may be making changes to those testing requirements as well. So look, in terms of our new cases, as I said, 154 new cases. I don't have any further breakdown in terms of ages and the like, but we do try and let the public know how many are vaccinated and how many are unvaccinated, and absolutely we have seen higher percentages as compared to our population vaccination rate of unvaccinated people making up our cases. And we have 5 people in hospital at the moment. I did have one further thing to say. We've had, as people know, we test wastewater. Now again, this changes with time. We're getting lots of positive wastewater all across metropolitan Adelaide. That is not unexpected because we've got cases there now. But what we have been doing is looking very closely at our regional centres, and Border Town has had a couple of very strong positive results, and we do not have any cases there at the moment. Now, I might have thought to myself, perhaps that's somebody coming in from Victoria using public toilets, but the signal is very strong, and what we would urge people in Border Town to please go and get tested, particularly if you have any symptoms, and we'll make sure that we have the available testing capability there. Obviously, as we don't need to be doing the interstate testing, that should be possible over the next 24 hours. So that's just an important thing to point out. Now, you did have some questions also about contact tracing, so if I could just make a couple of comments about that as we're seeing increasing numbers. So certainly the team in COVID Ops that I oversee are working extremely hard. We now have broken into 2 shifts, and we've been doing this since we opened the borders so that we can cover a longer period of time during the day as our State Control Centre also operates. And the real focus now is on saving lives and making sure that we therefore focus on the most vulnerable people in our community. And so that's focusing on people who are not vaccinated, who are cases, people who are in high risk or vulnerable categories, so older people and people with chronic health problems, but also we're focusing on high risk settings. So when we see cases in, somebody asked in an aged care setting, obviously we have a very rapid response in that regard. Moving forward, people have been used to in the past getting a phone call if you're a close contact of a case or a casual contact. Well, you may not get that anymore going forward. It may be a text message, and also we do advise that we will be keeping as up to date as we possibly can, but bearing in mind that we're focusing on the higher risk settings, that we will be having those exposure sites on our website. And it's really pleasing to see that people have looked at that and have seen that they were at a particular exposure site, and then have decided, yes, I'm a close contact or a casual contact, and then have followed those requirements. If somebody is a case and tells you, I have COVID and I think you're my close contact, and what we're expecting you to do is, if you're vaccinated, that you'll have 7 days of quarantine. If you're unvaccinated, 14 days of quarantine, and it's those people we would really like a test from. And we've been updating our website to make sure that all of that information is there, because as the numbers increase, it's not possible to get to everybody on a personalised basis, but we still need to make sure as a community that we're providing that information out. In terms of businesses, again, we make every attempt to contact businesses as soon as possible if we know that there has been a case there. But as you can appreciate, if there are more businesses impacted, it's not going to be possible to get hold of somebody by phone in every instance. So we'll be emailing or leaving a voice message on your phone. And then we have, as people know, we provide extensive information about what it means to businesses in terms of their close and casual contacts as well. So we are moving, and we are moving quite quickly, and it's always been an evolving situation. But hopefully I've been able to provide a bit more rationale about why we've made those changes today for the interstate travellers.
How many tests yesterday?
So this is SA pathology, 16,000, and because we've done the press conference a bit earlier, then I don't have the ClinPath and ACL, but those numbers will add to that.
I guess that's what I wanted to ask, is that for those businesses who know that they've had a COVID positive case there and haven't yet heard from SA Health, how do they respond? What are they supposed to do? Wait for that call?
Yeah, no, I mean they will get notification as soon as we can get to it. But we did provide quite detailed information in terms of our matrices, and people perhaps thought that was a bit over the top, but I guess we were trying to prepare businesses for what would be happening in the future. So there's information there about close and casual contacts, and people can so if you happen to have people that are in your workplace, for example, it is possible to work through that matrix and make a determination.
You mentioned mentioned that high-risk sites would be the priority. Why hasn't the Lyle McEwen been named as an exposure site yet? We're told that there's the birthing unit has had to close temporarily and people be sent home, that there were 2 infected midwives and an infected pregnant woman.
So, like many of those high-risk sites, and I've got a number again that haven't perhaps come to your ears as media, we have a lot of information directly from those sites about who was there at the time in terms of close contact. So there's not a need to be putting that out into the public arena because we know that we've already been able to contact those close contacts.
Professor, we all appreciate the rules, and it's a very dynamic environment, but the contact tracing exposure website was not updated for nearly 48 hours from 6:24 p.m. on Saturday night to just before 5 o'clock last night. What do you say to people that are starting to have a lack of faith or trust in SA Health's ability to keep on top of cases when these exposure sites are not updated for such a long time?
Yeah, I mean, we're always looking at trying to improve our processes, Andrew, and we'll continue to do that. And of course, we're experiencing a high volume, and it's important for our team to prioritise. So there are aged care facilities that we've also responded to, and so there are other things that may have taken up our priority, but we will endeavour to get all of those sites up because it is important that members of the public can see that. I know it's stressful, it's an uncertain time at the moment. We've got Christmas coming up, people getting quite worried about whether or not they're going to catch COVID. Let's just take it back to the real basics about how you can protect yourselves. If you haven't got vaccinated, you really need to be getting on and getting yourself vaccinated. I know there was all this stuff on social media about how dangerous the vaccines were and all of this sort of conspiracy theory. We really got to get past that now. We've got COVID in our community, we've got safe and effective vaccines, and if you are eligible for the booster, please go and get that booster. We are seeing with Omicron, with the ability of that particular mutation to not be, the vaccine to not be as effective just with the 2 doses, really important to get those boosters. And if you are sick, I'm hoping that now with the bookings improving and also we've cut out the interstate travel requirement, you'll be able to go and get tested. Wear your mask. It is also a really important thing in terms of protecting yourself when you're out and about. So that's really where we are at. I know that this is quite a different situation for all South Australians than we have been in before. My team are monitoring the situation very closely, as well as, of course, doing all the contact tracing. We're looking at the data coming in and making and providing advice and about where the numbers are likely to go and predicting what might happen in the future so that we can try and stay ahead of that curve.
Can I ask you just back about the situation with regards to testing turnaround times from Interstate? We understand that, say, in a place like Mildura at the moment, there's no guarantee that people who are in Mildura will get their result back in 72 hours before they come into South Australia. What is your advice for people who are interstate and in places like Mildura? Should they still come if they haven't got a positive?
Yeah, so look, we're very keen that that people still have that requirement for that test before they come. I might pass over to the Police Commissioner because his team is involved with the compliance. To me, it's more important that the test is taken, and I know that the testing times have also blown out interstate. And if I could just make a point on that, obviously the requirement for our state and indeed a number of the other states to have pre-departure testing is putting a strain on the testing in New South Wales and Victoria. So I'm very mindful of that. I'm watching that, and it may be that at some point in the near future we will be dropping that requirement as well.
Before you hand over, how many cases did we end up having at the cricket? We understand there were several positive cases.
So I've had an update this morning. We've had another 2 people that tested positive and have been at the cricket. I don't have any details of where they were, which part of the stand and such like, but the team will be working through that today.
So how many is that in total over the course of the cricket?
So there were 2 broadcasters and then 2 patrons, so that's 4 that we know about at the moment.
Professor, just one other question about New South Wales. There's lots of concern in the community here about the protocols around masks in New South Wales, and with the rapid escalation of cases there, if they're not mandated, is there a point where you will look at closing the border with New South Wales again, or is that completely off the table?
Look, I think all South Australians would agree with me that we do not want to close the border if we can help it. It would be good if we can move as a whole country at this point, and I'm very pleased that there's been an emergency national cabinet called tomorrow. We know as chief health officers that it is important to be wearing masks. We also know here in South Australia, our experiences when we just highly recommend it, many people are not sure whether to wear it or not. And I've been in situations where I can see people looking around, who's wearing a mask, should I wear it or not? It's much simpler and much clearer if there is a mandate and a requirement, then everybody understands, oh, that's what we do, we wear masks. And we've certainly had really high compliance with that in South Australia. And I know it's getting warmer and it may not be as comfortable, but I'm really grateful actually to the South Australians that have heeded that and they wear their masks.
But can I just go back to the cricket very briefly? Can we just go back to the cricket very briefly, Professor? Are you absolutely certain that the 19-year-old who was knowingly positive in the community was not at the match? And what information will you be providing police to assist in their investigation? Will that include QR code data?
So when you go into Adelaide Oval, you have to activate your ticket because you obviously have to get through the pass, and then you also have to QR check in at certain points within the Adelaide Oval. As far as I'm aware, that person did not activate their ticket. As you can see, Rory, I got 154 cases today. I won't be going into a forensic about where that person went, but the Police Commissioner might want to provide further information.
Just on testing at the moment, do you have an update on the turnaround time for test results in SA at the moment?
I can get that for you later today, but we have a really, really rapid turnaround time, and we're very proud of that. We want to be able to maintain that. Our laboratory capacity is holding up at the moment, but that's again another reason for dropping those interstate testing requirements to make sure that we're using the testing where we need it. And at the moment for South Australians, if you have symptoms, we want to get you tested.
Professor, can I please ask you, sorry, do we have anyone in ICU at the moment? And if we've only got 5 people in hospital, does that not show the power of vaccines, that they are actually working and we seem to be keeping on top of this in terms of people going to hospital?
Well, look, absolutely. I mean, I think that the vaccine message really does need a big Guernsey here, because vaccination really is doing the heavy lifting for us. It doesn't mean that we have to do away with everything else, and that's obviously quite clear in the way we're managing this in South Australia. As my understanding is, there's nobody in intensive care, but just to, and not to put a downer on this, but it usually is a week to 2 weeks once you start getting increasing case numbers that you see the hospitalisation rates go up, and it obviously depends on the age group of people that are catching COVID. So I'm really pleased with the high rates of vaccination in the older age groups in South Australia. Many of these people will be just about due their booster, and so please go and get it. There's a lower rate of vaccination, you know, it's more like 75% fully vaccinated in the younger age groups. You're the people that go out and about and perhaps enjoying hospitality in Adelaide. It's really important that you get yourself vaccinated as well, because that's how you're going to protect your loved ones, the older people and more vulnerable people in your family.
How long finished?
About 5-10 minutes.
Can I please ask for some clarity around testing requirements for pregnant women about to go into labour? Is it right they have to get a test within 72 hours? I ask because we're hearing that some have been caught up for hours waiting for a test in these lines, and is that perhaps an example of why rapid antigen testing might be a good thing?
So this is a requirement that hospitals have, and also there's been a requirement for surgeons in our state to have people have a PCR test. Now my preference would be for rapid antigen testing in that situation, as it's a surveillance test rather than a test on symptoms. We do have the ability now, we've rolled out rapid antigen testing across our hospitals and also in private hospitals, so we'll look to make those adjustments in coming days as well.
Professor, is SA Health becoming overwhelmed?
SA Health is a very stoic organisation. We do a really good job. We've got great people that work for us. we've done a lot of planning, that we're putting that planning into place. What we are doing now, and it's important to have this press conference, is to take the South Australian community along with us. So as things are changing, as the pandemic's evolving, we have to do things differently. Our strategy is not about the number of cases, it's about saving lives, and it's to make sure that our hospitals don't get overwhelmed. And as that strategy changes, we've just got to make sure that we're informing the public about that as well.
How many cases have been recorded at the Lyle McEwen? Because I understand that the infected midwives were working in several other departments.
Oh, I don't have the numbers for you, Andrew, but we can get that for you later.
Professor, can I just ask you, just before we go to the Commissioner, what advice do you have for people coming into Christmas who are looking to host Christmas, gathering with family over Christmas? What should they be doing to make sure that they and their loved ones stay safe?
So first up, if this is me, I'd be looking at having an outdoor Christmas, well ventilated. I would also be making sure that people are not coming if they have any symptoms at all. I personally would not want anyone unvaccinated coming to my Christmas party, and that's probably about where it would sit for me. We've got to keep. I know it's lovely to have people come together at Christmas, but we do need to think about keeping ourselves safe and other people safe. The other thing I think I would do is have a look at the SA Health website in the couple of days leading up to Christmas and make sure that I hadn't been at any of those exposure sites.
Commissioner, could we please have a word? Thank you, Professor. Maybe we should get you starting next time so you don't have to stand there all the
Maybe
time.
the chair. Maybe just the chair. You should stand up. You can be sure.
Commissioner, you obviously sign off on all these changes. What swayed it for you, based on what we've already discussed? In your opinion, what changed?
Well, primarily it was the advice from Professor Spurrier. She came into the meeting this morning with a proposal to remove the requirement for interstate arrivals to have a test on arrival, and that was discussed, and there's a consensus that would have an immediate effect on the impact on our testing stations, but it would also not necessarily significantly increase risk in South Australia and enable us to prioritise those people who should be getting tested.
So can you rule out, we've asked the Professor this, in your expert view as State Coordinator, border lockdowns or statewide lockdowns, are they off the table now as far as you're concerned?
They are not on the table at this point in time.
Can I just ask you about aged care, Commissioner, of all the settings that you're most concerned about? Is that right up there on the COVID ready committee?
Well, all vulnerable communities attract a particular focus by the various groups that meet to discuss the management of COVID-19 in South Australia. Aged care facilities are one of those, and as Professor Spurrier said, and perhaps even the Premier, there is a focus on making sure that the people who are working in that sector have the highest level of protection, not just for their own protection, but for those people who are in that sort of facility.
How are your investigations going into the movements of the 19-year-old person who was actively in the community over the weekend, and are you seeking additional information from SA Health?
Well, we have investigators that are examining that. I haven't had an update this morning, but I do know that the investigation is not concluded. They will be seeking information from SA Health. I don't know the specifics of that, but I can say that QR code information is not available to us for prosecution purposes. It is strictly for contact tracing purposes.
Commissioner, just following on from that and appreciating that you can't talk relatively specific of the details of this teenager, prima facie it appears that he got a message from SA Health that he was tested positive. There is discrepancies on whether or not he saw it or he shared it with his friends the following morning or that night. What's your message to people that might want to ignore such text messages or legal directions to go on quarantine if they are COVID-19 positive? And what's the effects therefore on the community?
Oh, look, I think that's quite evident that if you receive any advice, whether it be a telephone call or a text message or any other form of communication that informs you that you are COVID positive, then you should follow the health advice, strictly follow the health advice. Isolate, make contact with SA Health and follow any further instructions you are provided. By not doing that, it's not just about putting your own well-being at risk, you are compromising those people you care about, and you're also compromising the broader community. And that's not just about people contracting COVID, it's about people going into quarantine at a particularly sensitive time of the year, and it's also about businesses who are impacted by the concerns that start to grow through the community. So this advice is provided for very specific purposes, and people should follow that advice.
We're now just 4 days out from Christmas. What is the QR code data looking like? Have you seen a drop off?
The last time I checked it was on Monday, and we have been very consistent over the last 3 weeks. In fact, on our peak days, and I think the peak day last week was the 17th of December, there was somewhere in the order of about 2.3 million check-ins, which is consistent with previous weeks. So we haven't seen a drop-off. I think whilst people might be talking about it in their social settings and amongst friends that they're not going to QR code because they don't want to be put into quarantine, behaviour is not replicating that. We all know people who don't QR code in, but they are the distinct minority. Most people are doing the right thing, and that's evidenced by the QR check-in data.
Commissioner, 1% of new cases are from international arrivals. Why are you forcing them into a week of, sorry, not forcing them, why are you making them do a week of quarantine?
So what was the question, Harvey?
If 1% of new cases are international arrivals, why make them do a week in isolation?
Well, that's based on the advice from SA Health. That's what the direction is structured around. But I can say, and I'm sure Professor Spurrier would agree with this, that they are under constant review. The original plan, before Omicron raised its ugly head, under the Delta management plan, was that at the time of hitting 90%, we would be removing quarantine requirements for international arrivals. That's obviously been suspended at this point in time until we know more about Omicron, so it is always being reviewed.
Commissioner, could I just go back to QR codes? You're saying that the checking data is relatively consistent. What about the number of phones being used to check in? Has that dropped off at all?
I didn't specifically look at that, Andrew, so I don't know the answer.
And also, there's been huge concerns about people needing to quarantine in the lead up to Christmas. I know the Premier yesterday suggested that home quarantine rules were under review and might potentially change when we hit the 28th of December. What is, and I know Transition Committee didn't meet this morning, what is the current thought process on home quarantine when we reach 90%?
Well, our plan at the moment is to hit that 28th of December target. Obviously, and we've said this right throughout the course of our pandemic response, that it is a continual review process. We have a plan, we are working towards that. It relies on the community hitting 90% or being very close to it. In terms of any further changes that are likely to occur, then that will be a process where we'll look at what can be introduced given where we are at that point in time. So there is no discussion at this point in time to reduce the quarantine period from 7 days for vaccinated people.
At this time, but when we get to 90%, is that something that will be considered?
Well, it will be considered as we have a better understanding of how we're performing with the current situation, with positive cases being in the South Australian community, how the health system is managing, and what Omicron really looks like when we know more about that.
Great.
Thank you.
Thank you.
Terrific.